Good afternoon, ladies. Today on my live, I wanted to talk to you about something I've been very, very engrossed in lately, and that is sperm health. So I noticed that with a lot of my clients, their male partners struggle with showing up to make the changes that they need to make in order to have better outcomes with IVF, IUI, all things fertility related. So if you're somebody who feels like struggle around that, this one's for you. If you're a woman who has reoccurring pregnancy loss, if you're a woman who has low quality embryos, if you're a woman who has early implantation issues, this is for you. So what's true is that when you have early implantation issues and issues with embryos developing, a lot of the time the issue is the male factor. So one of the struggles is, right, why isn't this being talked about? What are the solutions to this issue? And why aren't there better options given to women who are in these circumstances instead of another round of IVF with different medications? So male factor is 50% of the equation when it comes to fertility. So what fertility clinics do is they test the sperm, right? They test the motility, the mobility, and the morphology. So motility is super important. Sperm has to get to egg. The amount of sperm is really important because you need to have enough sperm to penetrate the egg. Morphology is also important because it needs to be a certain shape to actually physically penetrate the wall of the egg, which is a very strong structure. So here's the question that I want to ask that you should be asking. If we're looking at all of these different physiological things, the shape, how fast it goes, how much they are, why are we looking at the quality? We're constantly talking about egg quality, but we're not talking about sperm quality. Okay, so this is a big deal. So you could be looking at all of these external things about the sperm. I'm calling them external because we're talking about how it moves, how it looks, and how many there are. Very external information. We're not actually looking at the quality of the DNA of the sperm. Most, I'm going to say 90 something or more percent fertility clinics, reproductive endocrinologists, they are not testing the DNA integrity of the sperm. So women's eggs are constantly being, looked at for quality. We have ways of determining it, which is a whole other conversation because I think those things are also fluctuating and sometimes not accurate. But what breaks my heart is seeing women like you who constantly blame yourself for why your IVF isn't taking, why implantation isn't happening, why you're doing these cycles and nothing's happening. Either, again, implantation isn't happening, or it does and it doesn't stick and you have a chemical pregnancy, or, you have a blighted ovum, or you have early miscarriage, right? Maybe you get the heartbeat early on and then it fails to progress, or you don't have a heartbeat and, you go on 7, 8, 9, 10 weeks. It breaks my heart that women blame themselves for this because it's very likely that it's not your fault. And I'll tell you especially when. It's especially likely that you're not the problem if you've done all the work to change your nutrition. You're taking really high quality supplements that are working for you, that you're not over exercising, but you're getting a decent amount of exercise, or, you're active, that you're doing things to help mitigate your stress, that, you know, there's no reason why you're not getting pregnant, okay? That could be unexplained infertility. That could just be whatever, circumstantial, like why it's not happening for you. Especially women who are like, everything seems great here. We don't know why it's not working for you. Let's just try a new set of chemicals and pharmaceutical drugs to try and pump something out. It's like, the problem is we're not looking at the right part of the equation. So I want to tell you, ladies, about sperm DNA fragmentation. Have any of you heard of this? If so, drop a comment below. DNA sperm fragmentation is what happens to sperm in their production cycle. I often talk about the egg production cycle and how we really want to support that and keep oxidation levels really low. We want to keep the powerhouses really amped up, the mitochondria. So sperm goes through the same process. It takes about 3 months for sperm to be developed. So during that process of DNA production in the sperm, what happens is that sometimes the DNA will fragment or split. These are very, very, very delicate parts of DNA that we're talking about, right? They're microscopic parts. And what happens during that process of production is that the DNA can, not be a good quality DNA. Doctors aren't testing this. You're going in there possibly with low level issue with this main constituent of conception. Low quality is going in there. So I really want to encourage you ladies to look more into DNA sperm fragmentation. There are some outside labs that offer it. And I'm going to do another live explaining to you a little bit more about DNA fragmentation and what causes it and all of that. In the meantime, I'm going to drop an article below this. You can read a little bit more. Bring this up to your reproductive endocrinologist. Tell them you want to get a DNA fragmentation test for your sperm. It costs money, and health insurance does not cover it. But if you're already in multiple IVF cycles, you keep getting results that aren't working for you, I need you to check this out. I need you to look here because you could be throwing your money away. All right. Sending you ladies lots of love. I'm going to put this link below. It's a medical article written about this in the aacc.org site. And that's an acronym that I actually don't know offhand. American Association for Clinical Chemistry. So I'm going to put this little article down there so you guys can educate yourself, and I'm going to talk about it more with you because it's so important. All right. Take care. I hope this helps you.